Okay, everyone. So lastly, we are going to be focusing on drug-food interactions. And as you can see by the picture, there's one really big one that I can almost guarantee will be on your exam. And that is statins and grapefruit juice. Now, firstly, it seems odd, and I understand that grapefruit juice isn't necessarily the most common, drank breakfast juice. However, some people really enjoy their grapefruit juice, and if they're taking a statin, that can be an issue. Why? Because grapefruit juice contains a compound known as furanocoumarins. Now, furanocoumarins inhibit CYP3A4. Remember, there are CYP enzymes, or drug metabolizing enzymes, which we talked about in the drug-drug interaction video and explained in more detail in the pharmacokinetics video at the beginning of this presentation. Anyway, if you're just jumping in and joining us, furanocoumarins inhibit CYP3A4, and CYP3A4 is the enzyme responsible for metabolizing most statin or cholesterol medications. Now, the notable caveat, although most statins are metabolized using the CYP3A4, rosuvastatin or Crestor and pravastatin or Pravachol, as well as some other lesser used statins, may be used to avoid this interaction entirely because they're metabolized without 3A4. I believe some of them use like 2C9 and some others. If you can't get around prescribing a statin to someone who absolutely swears that they need to have their grapefruit juice, you could look at rosuvastatin or pravastatin as an alternative option to what you were originally going to go with. However, for most other statins and the most commonly prescribed statins, grapefruit juice does interact. It increases the concentration of the statin in the body by putting the patient at a greater risk for toxicity and side effects. And that includes rhabdomyolysis, another alternate pronunciation. And rhabdomyolysis is just muscle breakdown, pain, and aches, as well as skin flushing, because the concentration of the statin is building up in the body because it's not able to be effectively cleared and metabolized by the enzymes. So you have a whole bunch of unused drug that is just accumulating in the muscles and in the other tissues that causing these adverse reactions. Now, it's important to note as well, one glass of grapefruit juice will not cause this interaction to occur. There's simply not enough furanocoumarins in one glass of grapefruit juice once a week or something if you're taking a statin drug to really affect how well your statin medication is working. However, if you go through a bottle a week or something like that, or you go through multiple glasses of grapefruit juice every day and you're taking a statin, that's when you might just start seeing some of these effects. So the interacting statins, the most notable ones, that is, would be atorvastatin, otherwise known as Lipitor, lovastatin, Mevacor, and simvastatin, or Zocor. Now, in a different vein, instead of affecting the enzymes, sometimes foods or vitamins can affect the drugs themselves. So we have these things called multivalent ions. So put on your chemistry hats, your lab coats for a second, because we're going to take you back to high school chemistry class. If you had to take one in high school, you might be aware of some of these familiar symbols from the periodic table. Multivalent ions are just charged particles of dietary metals, which everyone pretty much gets through their diet. It's calcium, magnesium, iron, and aluminum are the four main culprits. So you can see they're multivalent, meaning they have a lack of two electrons in their valence shell. That is the shell of electrons. If you imagine an atom as like a planet and the electrons is like a little moon orbiting around that planet, they have two less than they should, for instance, in calcium. That gives the calcium a 2+ charge. So it's a calcium 2+ ion, magnesium 2+ ion. Fe is the periodic table symbol for iron, so that's a 3+, and aluminum is represented by Al, and that's a 3+ as well. So these ions are normal parts of our diet, and they're found in a multitude of not just foods, but also supplements and other vitamins. So for instance, antacids, so what you would use for heartburn or to calm a sour stomach, many of them, including calcium carbonate, obviously, which is Tums, and aluminum hydroxide, which is Gaviscon, milk of magnesia, which is just magnesium, and many others contain these multivalent ions. They're also found very commonly in dairy products, especially milk and yogurt, as well as, you can imagine, in vitamins. So a multivitamin might contain multivalent ions. Now, what's the problem with these? Well, they're chelating agents. They're what's known as chelating agents, meaning that they bind to certain drugs and prevent their oral absorption, which decreases the efficacy of those drugs. So if someone is consuming or eating some yogurt for breakfast and washing it down with a nice glass of milk, and they decide, oh, well, I should take my morning antibiotic or my morning thyroid pill, and I should take it with the milk and my breakfast of milk, yogurt, and I don't know, cheese on omelet or something like that. All of those foods, those dairy products and their multivitamin that they're also taking, that can bind to the drug, and then it would render it ineffective pretty much entirely. It's going to bind to the drug and get the drug excreted out of the body before it has a chance to do anything. It either does that or it renders it ineffective, because if the drug gets stuck to something, it can't be absorbed like it should be in the body and then exhibit any sort of therapeutic effect. So it just gets excreted out without having a chance to work. Now, it's easy to avoid this though, because the solution is just to space out your medications from the consumption of foods or medications that contain these multivalent ions by a few hours. So a lot of times a doctor might specify on a certain antibiotic or something, take this at least 2 hours before or 4 hours after food and drink, for instance. And that pretty much solves the problem, because as long as these ions can be digested and adequately separated from taking these specific medications, you should be fine and there shouldn't be any bad effect on the efficacy. So which drugs chelate or bind to multivalent ions? Which drugs interact with these foods, supplements, and over-the-counter drugs? Well, it would be some antibiotics, especially fluoroquinolones and tetracyclines, bisphosphonates as well, so your drugs for osteoporosis, including alendronic acid or alendronate and some others. And in addition to that, levothyroxine is a big one. It's actually the most prescribed drug in the United States. It's used to treat hypothyroidism or low thyroid hormones. And the brand name for that is Synthroid. So again, space out your multivalent ions from your other medications. Milk and antibiotics could be a bad idea, but it's not necessarily, as long as you take precautions. We also have what are called MAO inhibitors and tyramine. So tyramine is simply an amino acid that helps regulate blood pressure. So it's found in a number of foods, but you can see in the top right-hand corner of this presentation, you can find it in aged meats and cheeses, fermented products, alcohol, soy sauce, all the good stuff. And tyramine is just a simple amino acid that appears in most foods. And honestly, most people don't really think about their tyramine content in their foods. However, if they're taking a certain class of medications, they might want to do that. This class of medications are called monoamine oxidase inhibitors, otherwise known and more commonly known and abbreviated as MAOIs. So MAO, that enzyme, which is also, MAO is an enzyme which is responsible for the metabolism of neurotransmitters like dopamine and serotonin. So just like how your body breaks down medications through using enzymes, they also break down other things in the body like sugars and carbohydrates, and in this case, neurotransmitters, which are also normally occurring chemicals within the body as part of natural metabolic processes that keep our body running and going. So MAO is very, very important, especially in mood regulation, because it works on neurotransmitters associated with, say, anxiety, depression, happiness, emotions in general, which are dopamine and serotonin. However, drugs which inhibit MAO have antidepressant and anti-anxiety effects, which makes sense. If you're inhibiting the destruction of serotonin and dopamine, which is generally considered to be the active neurotransmitters for mood regulation, if you're keeping those neurotransmitters around for a longer amount of time and let them build up, then that could be a good way of fighting depression and anxiety. So some MAOIs are isocarboxazid, Marplan, phenelzine, Nardil, and tranylcypromine or Parnate. Now, you'll notice a lot of these aren't used very much anymore. They're the first generation really of antidepressants. They're mostly completely forgotten about today because of SSRIs and SNRIs. However, if some people have issues with SSRIs and SNRIs, you may find them on an MAOI. It's not necessarily a bad antidepressant medication, but it's not necessarily the first choice either. Now, when MAOIs are taken with foods containing tyramine, there is an increased risk of hypertensive crisis. Because remember, we had a tyramine that helps regulate blood pressure. So if you are messing with the concentrations of tyramine through this use of MAOIs, you could have an increased risk for going into a hypertensive crisis, meaning a blood pressure of over 180 systolic or over 110 diastolic in terms of the pressure. So these astronomically high blood pressure readings, which may indicate a hypertensive crisis, could lead to heart failure, heart attack, stroke, vision loss, you name it. You want to avoid tyramine with MAOIs as best as possible to avoid the risk, especially if someone has some underlying cardiovascular factors as well. And lastly, one of our probably most common and most talked about drug food interactions is warfarin with leafy greens. I talked a little bit about this in the last drug-drug interaction video because we talked about vitamin K and the role that it plays in warfarin, but it is worth reiterating when talking about these leafy greens because vitamin K plays an important role in the coagulation or clotting of blood. So the way that warfarin works is it's a vitamin K antagonist, meaning it prevents blood from clotting in patients at risk for cardiovascular events, so stroke and pulmonary embolism and stuff like that. So by antagonizing vitamin K, by stopping vitamin K from working in the body as well as it should and blocking some of its action, that's able to keep people nice and anticoagulated so they don't have these clots, especially say after a surgery or after a stroke, so they don't end up having a blood clot again. Now, consuming foods rich in vitamin K, which are mainly leafy green vegetables, as you could probably guess from the picture, may decrease the effectiveness of warfarin and increase the risk of blood clots because you're decreasing the effectiveness of that anticoagulation that warfarin is providing. Therefore, the risk of blood clots increases. Now, we have some examples of leafy greens down here: kale, spinach, Brussels sprouts, collard greens. Some people might not necessarily consider broccoli as leafy, but it is considered a leafy green, if not anything but for its vitamin K content. Asparagus as well. And in addition to green tea also has some anticoagulant properties, which are, or some coagulating rather properties, especially when brewed using like the whole tea leaf or taking green tea supplements. So that's another thing to keep in mind. If you're getting pills from GNC or something that have green tea in them, they could potentially inhibit the effects of warfarin and increase the risk of blood clots, even if you don't necessarily think of it as a leafy green. However, this is not an absolute contraindication to using warfarin. You can still eat salads while being on warfarin. When I worked at a Coumadin clinic for a time, I used to say, well, you can still eat a salad a night, but if you're going to eat that salad every night, make sure you eat it every night. Don't skip it. Don't go from eating salads every day to eating salads once a week. Don't go from eating salads once a week to suddenly becoming a vegetarian and only eating salads. You can still eat leafy greens while taking warfarin, but you should not, and I underlined, not suddenly change your diet without informing the provider so they can change the warfarin dose accordingly. So people can go increase their dose of warfarin if they wanted to have a diet change, or maybe they're going on a diet, they want to lose some weight. That is fine. You just have to let your provider know, because even small variations in the amount of leafy greens consumed during the week can completely throw off someone's coagulation if that becomes a habit, and it varies very much. So that is just about it for our food-drug interactions. I would encourage you to watch over other parts of the video and send me any questions if you have them. All right, have a good one.